Don't take Tylenol. There's no downside. Don't take it.
Doctors are pushing back on President Trump's new claim that using Tylenol during pregnancy could lead to autism in children and the administration's scrutiny of vaccines. Joining us by Zoom to talk about this morning is Wish TV's medical expert, Dr. Janel Gordon. Let's get right to it. Let's talk about Tylenol first. Is this safe for pregnant women to take?
So we do recommend that individuals take Tylenol if it is needed. It's always a conversation that should be had by their care team with the patient. And so if there are concerns, please make sure that you're discussing this.
What exactly has been studied when it comes to acetaminophen, what's used in Tylenol, and its link to autism in kids or not link? What's been studied in this?
Yes, unfortunately, autism is one of those conditions that we are still trying to figure out what is causing it. We do know that there is a genetic component. It's likely multifactorial, and there is also likely an environmental cause or causes as a result of this condition. Multiple studies have shown that Tylenol or acetaminophen specifically and paracetamol in other parts of the world is not the cause of autism. There were some studies some years ago that said that there was a causal link. However, we do know now, after looking at it further, a study that was published in the Journal of American Medical Association, or JAMA, last year showed that there is no causal relationship, and actually looked at individuals who were exposed in pregnancy and their siblings who were not, as well as controlled subjects who were and were not exposed, and no link was found for acetaminophen to be a cause of autism.
I had a baby 8 months ago. Doctors tell you when you're pregnant, do not take ibuprofen. I was always advised to take Tylenol. The president, in his soundbite that we just heard, said there's no downside to not taking it. But there is a risk if you are pregnant and have a fever. So is there a potential downside in women just avoiding medicine altogether here if they need it?
That's a great question, Hannah. So anytime we take a medication, there is always a possible risk of side effects and complications. We also know that there is a condition inside the body, and we're receiving warning signs, be that a fever, pain, that if we don't do something, including at times using medication, that there could be severe complications that may result. So again, it's always important that if something is not right with your body, that you are seeking medical evaluation, and at times urgently or emergently.
You were reminding me in the break, the president did mention folic acid as something that people should take. That's in prenatals. Is that something you guys want to remind women that they should be taking?
Yes, so we heard from officials at the FDA that they're going to be looking at leucovorin to see its benefit of use in pregnancy. So we know that folic acid or folate is vitally important. There were some studies that also came out looking at neural-tube defects possibly being the cause of autism. A study did show that in individuals with autism, there were a higher likelihood of neural-tube defects, but then there were individuals with autism who did not have neural-tube defects. To prevent neural-tube defects, other intellectual disabilities, it is important that women of reproductive age, even if you're unsure if you want to get pregnant, you should be taking at least 400 micrograms of folate or folic acid daily. And oftentimes this can be found in a prenatal vitamin, but I do recommend that you flip that bottle over and make sure that it has enough in it.
Now to vaccines quickly before we go. Where does that stand with autism?
So a lot of hysteria and confusion has come out surrounding vaccines for many decades now, notably the MMR or mumps, measles, and rubella vaccine, linking that to autism, linking the preservative that oftentimes was found in vaccines, thimerosal, to autism. Studies have shown us time and time again that there is no link between the measles, mumps, and rubella vaccine and autism, or thimerosal and autism. Also, some concerns have been raised about us giving multiple vaccines to a child at one time and how that could increase the risk for autism. Again, studies have shown time and time again that that is not accurate. We do know that we need more information as it relates to autism and what could be causing it so that we can prevent it. People are concerned that there's an uptick in the incidence of the disease. It's likely that we've increased and broadened the diagnostic criteria, and also we're talking about it more. So more and more people are being screened. So we do need more answers. However, what we're seeing right now, we do not find to be the actual cause, meaning Tylenol does not cause autism autism from what recent studies have shown us, and measles, mumps, and rubella vaccine, nor having multiple vaccinations administered to a child at one time, no link to autism spectrum disorder.
All right, Dr. Gordon, thank you for answering our questions this morning. As you always advise, if you have questions, talk to your doctor. Dr. Gordon, thank you.
Yeah.